As the healthcare worker enters the room, they perform hand hygiene. It would be best practice to perform hand hygiene when you walk into the room so you're ready to attend to any patient need. This also prevents germs outside the patient room from being brought into the room. However, once in the room, it's important to note that surfaces in a patient's room are considered dirty. Sure, the germs in the room may be the patient's germs to begin with, but that doesn't mean those germs are welcome everywhere. A patient may be colonized with a microorganism that is not causing them any harm. However, if that microorganism is introduced into the patient's bloodstream, mucous membranes, or somewhere they don't belong, it can cause an infection or harm to the patient. Touching items in the room can transfer microorganisms to the healthcare worker's hands, which then touch other surfaces and objects in the room and transfer the germs further. The healthcare worker has identified that the patient's bandage may require care. First, she needs to collect her supplies. Stop! This is the moment for hand hygiene. Hands must be cleaned before touching supplies. Remember, what you touch, you transmit, and surfaces and items in the room are considered dirty and may be contaminated. Hand hygiene is the most effective way to prevent the spread of germs to clean supplies, other surfaces, the patient, or you. There are two methods to perform hand hygiene: soap and water, or an alcohol-based hand sanitizer. When using soap and water, cover all surfaces of your hands and focus on your fingertips. This should take at least 15 seconds. The healthcare worker sets the supplies down on a clean surface. Since this activity will likely involve exposure to blood and body fluid, the healthcare worker puts on clean gloves. The healthcare worker provides care and follows procedural guidelines as required for the care activity. Once the healthcare worker has completed her task, she removes her gloves and disposes them in the waste receptacle. Stop! This is a moment for hand hygiene. Hands must be cleaned after gloves are removed. When using hand sanitizer, cover all surfaces of your hands and focus on the fingertips. Rub your hands until they're dry. If this does not take at least 15 seconds, you did not get enough sanitizer product in your hands. Hands and gloves can be contaminated just by touching inanimate objects and surfaces. Infections can be passed from person to person on hands or gloves. Proper hand hygiene and glove use can prevent the spread of infection. Change gloves between contaminated and clean patient care activities or body sites. Always clean your hands after glove removal. And remember, wearing gloves is not a substitute for hand hygiene.